It is an evidence-based program, treatment program for people with mild to moderate dementia. When you get a dementia diagnosis, a lot of times, people feel like that's it. It's a disease that doesn't have a cure for it. And what CST does is really, it just brings hope back.
Our goal with treating dementia is to keep people at home, keep them functioning. Without CST, people can decline much more quickly. I think CST can be as effective, and in some cases maybe more effective than medications, especially in improving overall cognitive skills, language, concentration, mood, and verbal skills.
And we have seen better than the research out there, our results. We actually have seen some improvement on their slums in 70% of them, and some of them only by a few points. But anything is significant. As we know, the improvement in cognition rolls over into their quality of life.
Probably the biggest benefit I've seen is the socialization part of it. Often these people are coming from very isolated lives. Their eyes don't work like they used to, so they don't engage in certain activities they might have. They don't hear as well, so they kind of isolate themselves. And on top of that, I think they come from a generation where the humor was different, the movies they remember, the memories, and they're kind of stuck in our world with their children and their grandchildren who have different senses of humor and memory. So it puts them with people that they can reshare those memories and talk about them and bring up more emotions that were tied to them and have universality between them and acceptance, because they're with people who aren't going to judge them or get upset if they have a word find problem.
Before she started doing this, the family, we were getting very concerned with her. She was isolating herself from people, and then when she got involved with this, she's just like, she's come back to life. She's talkative, she wants to be around people, where before she didn't want to do that.
I think it has opened up his life more. I really do. I think he's more receptive, but I think he opens up more, probably, to talk to people. And he enjoys this class. He really does.
It keeps me active. I don't just sit around and wait for something to happen. Well, they're all very, very friendly, and we all get to know each other.
Well, it's great. I would recommend it for anybody. Before I came here, I had a little TIA stroke. I couldn't remember stuff, I think that's everybody's problem. But just after I was going to this class, I don't know, maybe 3 or 4 months, my family really noticed that I was back. I could remember most everything,
When I initially evaluate patients, I'm looking for what their goals are for coming. The goals become important for us because it gives us a roadmap of where we want to go with them. We could meet every week, but for Janice and I, we want them to walk away with something.
The goal of CST is to get those neurons firing without making them feel de-skilled.
Because when you ask any person to give you a fact, there's an element of that you could be wrong. And if you can be wrong, there's anxiety. As humans, we don't want to be wrong. So the fact that I'm going to put somebody who's already most of these people are aware that they've got some concerns going on. So if I'm going to put them in a position to be wrong and to be even more aware that there's a concern, I'm doing them a big injustice.
It is very important that even though it seems kind of like a simple science, a soft science in a way, but that you understand the key principles behind it. Implicit learning versus explicit, where you're doing things subtly to orient them. Without directly putting them on the spot and asking them, what day of the week is it?
I think that's where it comes in that your people who run the groups need to have some knowledge of what they're actually doing. Because on the surface, it looks very simple. It looks like, well, my grandma could come in and run the group where you're having fun, you're just talking about movies. But clinically, what's going on behind that for Janice and I are a lot of neurological, cognitive, psychosocial thought processes going on about what we're really doing is not that simple when you break it down and when you really understand what your goal is in all of this.
This is a really a multidisciplinary therapy, and that's what's great about it. Being in a healthcare setting, we're able to utilize people like our speech therapist and our OT and with my social work background to really develop a program and to have all of those expertise. And I think that's what makes our program different.
So the group is set up that you have certain things flow the certain way so that there's a routine, so that they know what to expect. There's nothing, it's the same room, it's the same facilitators, it's the same group members, there's a group song that they sing, there's a sameness to it. And then we throw in little subtleties of change.
We try to get as much senses, and people have different preferences in what senses really stimulate them more. So we always try to have a couple different senses. Always try to, if we're doing an activity, we try to have a picture, a photo, so they have some other reference. We have things written on a board, so sort of a visual cue for them with the weather. The group name, we'll take a vote on it because one of the key principles is also choice. You want to give them a choice in the activity that they have, or a choice in any, as much of the process as possible.
Our job is to lead them through the path, to lead them from this thought to that thought to the next thought to the next thought, and keep expanding that out.
And the idea is to bring them from those past things forward to the present. Because that is how they learn, and that's how those new connections are made, is from bringing, and that's a very effective way to do it. Instead of just having them over-rehearse, old information, is to bring it forward into the present.
Well, I think overall what I see is just presence in the world. They come in, and we've had a case where in our first group, a woman that came in, and no matter what the discussion was when it came to her, she would tell the same story from childhood in the exact same order. Professionally, we call that ruminating. But the other participants were very tolerant. There were all different ones. Some remembered she had said it last time or 5 minutes ago. But as we progressed and she kind of got into the group and felt good, and the participants kind of cued her along because they'll help each other, by the end of that she was talking and spontaneously carrying on conversations. And we never heard that story again, and I thought that was interesting. And you can see a lot of times when they're in the group when the lights come on, especially if it's a topic that they love.
It has certainly been the most rewarding thing I've done in my career. Seeing this program grow and seeing the change and the difference it's made in people's lives, and we say quality of life, but it really does. It's making a significant difference in their lives. When you see the results and what it can do for people, you just want to help us to bring that to as many people as you can.
I think Janice and I are just light switchers. We just want to switch the lights on, and they come in, sometimes they come in very flat effect, and to get them to laugh and to perk up and to become intense, then they're ready to learn, and they're ready to accept and to think and to express and to connect, because we got them where we want them then.
And then they can take that success and take it back home, and it stays with them. It stays with them longer than just in that session.
Oh, I think it helps them have a better quality of life. If you become aware and can communicate better, I think that just really helps them and helps everybody around them. It's just a wonderful program. I'm just happy that he was able to be a part of it.
But before she started the class, she was very depressed. And then the change was just great.
There's so much fear associated with levels of dementia. When they can take steps to stabilize that and improve upon it, it changes their outlook.
It is engaging, gives them socialization, helps with memory, and overall just enhances their quality of life.
I wish our medications were better, but with the medicines and with the good work that we're doing here with cognitive stimulation therapy, at least we can give patients hope.
That's what I think they've given me, confidence. I really do enjoy coming. I do. I look forward to every Monday morning, you know. And then the teachers, Janice and Debbie, are so great.
Two of the most wonderful women in the world. They're kind, they smile, they think about everything. They want opinions. You give them your opinion. You can ask them for opinion if theirs. Yes, I recommend them highly. I recommend them highly. Give them a bonus for Christmas.
One of our participants, her grandmother had Alzheimer's, died of Alzheimer's. Her mother, her sister was also diagnosed. So it was a very upsetting diagnosis for her. She's in her mid-50s. And she said, I wasn't able to avoid the storm, but because of CST, I've learned to dance in the rain. And I think that really just captures CST.